I mean, like the concept of going under and getting a surgery done, that's not daunting.
Okay.
But the concept of waking up and not feeling like yourself, you know, that was definitely weird.
All right, so it wasn't your first surgery, but the first brain surgery you had, it didn't take? Like how long, like you said you had two. So that didn't take, or that was only one of two parts?
It was one of two. So the first surgery I had was a left temporal lobectomy, where they took out the region of the left temporal lobe that was where the seizures began, according to their stuff. And it resulted in me having almost a full year with totally nothing. I was having a few hundred every year, most of them complex partials, and 10 or 15 times a year they would generalize and become the tonic-clonics. They would usually happen in big clusters. So a big part of the motivation for surgery one was they were pretty sure they could make it be less.
At least the number.
Yeah, and that has definitely happened. Post-surgery one, I've had maybe a total of like 25 seizures. I was having a couple hundred every year.
Wow.
So substantially different, and they're not. They were clustering, so I would have, if I had like one on a day, for the next 3 or 4 days, I would have another 20 or 30. That was just like a given rhythm of how mine's worked. And since the first surgery, I have had no clusters. So if I have one, it's just that one, and then it's back to normal, which has definitely been successful. And then after the first surgery, about a year later, I started having the tonic-clonics again. And that's what motivated me to go back and see if they could do a little more to deal with, the life-threatening shit. If I could just have the partials and the complex partials, it's not that big a deal from my vantage point. But definitely the tonic-clonics and just disappearing and waking up, having no fucking idea what's going on. That's unpleasant.
So now, when you say partial, because I only have the blackness and the light. Like partial is just, you say like when people just space off.
Yeah, and like different people's partials. Some people's complex partials include like loss of awareness. Some people's, which mine fit the description of, are like, I'm still aware while they're happening. I can't really speak very effectively. It's very much, it's like you took some really good drugs or really bad drugs, basically, from my vantage point. And then at some point, pretty much whenever it tips over to unawareness for me, that results in a tonic-clonic for me.
Okay, so I guess I have them right before, because I usually space out to where I can't, like my rescue meds and all.
Yeah.
Like I'm looking at them and I know that's what they're for, but I don't, and then I go into my black.
So that's the complex window. And that lasts a long time for me. Sometimes I'm in that window for 2, 3, 4 minutes.
Gotcha.
And then it just stops.
Okay.
And doesn't turn to the tonic-clonic.
Gotcha. All right, we're not doctors, so the terminology, bear with us.
Yeah.
So you
I do have a neurologist who's a guitar student of mine.
Really?
Yes, he's the guy that I bounce off of.
No plugs here,
for
buddy.
info.
No plugs.
Yes,
here.
don't look into Jeff Labonte for guitar lessons.
So they set your date. Say it's January 3rd, or what day was it?
Mm-hmm. The first one was October. What was it officially? The 23rd, 21st, something like that.
So how do you prepare? Like, what did you do? Like the day? How do you prepare for that?
I mean, it's definitely a mind fuck, fairly literally. I was definitely in a place of some pretty heavy questions and despair, even by the numbers, you don't have a good sense of where it's going to go from there.
Yeah. They don't promise you anything. It's like we're going to cut you open, and there's a chance, like you were saying before, there's a chance nothing's going to happen. It's going to help a little bit, or it's going to help a lot. But there's still no guarantees at all.
I mean, I think the most reassuring thing was in my context, what I heard from the reputable doctors was, it's something like 5% or less chance that it doesn't get better.
Yeah, yeah.
And I definitely, I mean, things got a lot better for me, for sure. I was hoping I was going to end in the 60, 70% that just never had them again. I mean,
yeah.
hard to overstate how much I was hoping for that. It didn't go that way, but still, I've had so many fewer.
Okay. And then a year later, so you got your second one.
So I got the second one a
And
little
now-
more than 2 years later.
Okay. So now, are you more hopeful or are you more upset because the first one didn't take? And you're like more.
I mean,
like,
going
"Oh,
into the
shit."
second surgery, the chances were lower for me. And I also did actually, I had 2 surgeries. So I had a temporal lobectomy. The second time around, I had a dual surgery, dual procedure. So they took out a little bit more of the left temporal lobe where they were occurring, and they implanted the RNS device, which you may have heard some about. The neurostimulator, it's basically an ongoing EEG device that senses what's happening in that region.
Oh, yeah.
And once it learns the process, I constantly carry around my required magnet, the RNS system.
Okay.
And if I start feeling something, if I start feeling something coming on, I use this up in the region where it is. It's a permanent implant, and that turns it on
Really?
to be aware of something's going on here. And then if I do that a number of times, they'll then start to turn on the second facet of the device, which basically will actually give a stimulus, a 3-second stimuli to try and stop